Now this is CHWs, or community health workers. It's not really a term that we've necessarily used in Europe before, and it perhaps is historically, I think, more aligned with US and African countries or other developing countries. But in ECHOs, we use that term to mean those workers who may go by a variety of different titles, so outreach worker, HIV peer supporter, volunteer, public health practitioner, health promoter, peer educator, and so on. But also to mean any health professional and non-health professional who may offer sexual health support to MSM in community settings. And again, as I mentioned earlier, by community setting, we essentially mean any environment that just isn't a hospital or a clinical setting or a GP surgery or something like that. So this is deliberately a very wide definition to try and capture not only those that we may immediately think of, such as an HIV outreach worker who goes into a gay venue to do condom and lubricant provision, but we mean all of those who may provide sexual health support in different sectors and in different ways. So the definition you see here was crafted very carefully to ensure that the widest possible demographic of people doing community health work with MSM could be included in the survey. So we wanted a definition, therefore, that could include the widest spectrum of support, from full-time paid outreach workers to those who may only volunteer for a few hours every 6 months, through to GPs, so doctors, specialists, doing testing in gay saunas. Now, each of these examples, of course, are very different kinds of work that support MSM, but together what they do is form this body of CHW work that we're trying to capture. But it did become clear during the launch of ECHOs that in some countries we think participants are viewing, or potential participants are perhaps viewing the survey quite concretely and perhaps narrowly, and only in terms of what you might call a traditional view of an outreach worker, so this person who gives out condoms and lubricants and so on as part of working in an NGO. Now this is certainly the main kind of CHW we'd probably expect in many countries, and I think particularly those with large gay scenes such as the UK, Spain, Germany, France. But there are also a number of others doing sexual health work, which may be with the general population in community settings, but which of course is very likely to also include MSM within that general population. And such workers would be eligible to participate in the survey. So let's now take a look then at some of the examples of CHWs, all using different titles, but all providing sexual health support for MSM in community settings. So this is data from the actual live survey. And as you can see, the roles of people eligible to take the survey, whom we would therefore class as CHWs, are diverse. So to reiterate, these are all actual responses to people who have said they're doing community health work with MSM in community settings during the last 12 months and who are eligible to take the survey. So if we look at this again, now in no particular order, but if you look at the ones in red, you can see the usual types of titles we would expect to see, such as CHW, outreach worker, HIV project worker, counsellor, and so on. But if we look again a little closer in yellow, I'm sorry yellow doesn't show up particularly well, we can actually see examples of health professionals from the full health sector doing community health work in community settings. So here we've got a consultant psychologist, a nurse, a community pharmacist, an HIV consultant, a doctor in a community centre, a paramedic. So what we're starting to see then is that the pool of people who are doing CHW work, who support MSM in sexual health in community settings, suddenly becomes much larger than just the traditional outreach worker. So here we're seeing that CHW work is done not only by NGO staff, but by health professionals who may be part of the formal health service in a country, but who may also be working nevertheless in community settings with MSM. Now if we take a third glance then, we can also see in green CHWs, again actual data, who work in other sectors, so social work, education, youth work, with examples of titles like youth worker, social worker, street worker, we've got private practitioner, psychologist, and so on. So hopefully again what we're starting to see here is that actually CHWs who support MSM can come from multiple sectors. So it's not even just about the health sector or the NGO sector, but also from social work, education, and youth services. Now, of course, not every country is going to have these kind of examples necessarily, but many will. And I think what's important to ECHOs is to try and reach those people doing CHW work so that we can develop a comprehensive picture of the community health worker workforce. Because obviously the more we know about them, the more we can reach the right people, the better understanding we can have at European level and at member state level of what they do, and of course of their training needs, in order to develop a training program as part of the ESTICOM project to help them be as effective as possible in their roles and essentially start to build the capacity of the CHW workforce.